We're back here in the final segment of our program, and right now we are going to show a procedure, Dr. Graham, a little video of how you go about examining for cervical cancer.
Yes, it's a video that I put on my Facebook page just so women could be aware of exactly what the Pap screening involves, and basically to encourage them so they could see, hey, it's not a very difficult or very painful procedure.
Okay, good. Let's see it now.
Good morning and welcome to Teal Fridays. I'm Dr. Nina Graham, and I'm encouraging everybody to get their Pap smears for the month of January, because January is Cervical Health Awareness Month. And ladies, I want to encourage you to pap that. I have one of my patients here this morning that adhere to our pleas and have come today to have her annual exam and her Pap smear. Can you come down a little bit on the bed? Normally you would have the patient come down a little more. The patient is positioned well on a nice comfortable bed, and she's in the lithotomy position, and let your knees fall apart. It's a very simple exam and it doesn't take too long to do. You're going to feel some pressure, okay, hon? All right, take a deep breath in. Wonderful. Okay, relax a bit. You're all right? That's simple, ladies. And with the conventional Pap, you would use the brush and the spatula. This particular Pap test is interesting in that it's called a thin prep, and you get a better yield of the cells of the cervix with the thin prep. Also with the thin prep, you can test for HPV also. So you can do two tests in one. If the patient wants her HPV status, then you'll be able to determine what her HPV status from the same Pap test. Okay, and we use a nice spatula, soft, and the yield is better. The HPV, determining the HPV status of the patient is very important, because as you know, the HPV, persons can contract HPV. About 80% of women will contract HPV at some point in their life. So, and we know that HPV stands for the human papillomavirus, which is the cause of cervical cancer and abnormal Pap smears in about 90% of cases. So it's very important to determine if you have HPV, and you can have that done during your Pap test or a thin prep. So ladies, be sure to get your annual and to do your Pap at some point this year, preferably in the month of January. January is Cervical Health Awareness Month, and cervical health and cervix cancer, is preventable. Do your Pap smear today.
Well, interesting video it was, Dr. Graham. And for the rest of the month, well, the month is just about gone, eh?
Yes.
And you've had a successful month so far?
Yes, I got to speak to a number of groups.
Okay.
And my Facebook page with a lot of persons visiting the page and looking at some of the risk factors and how to prevent, and yeah, so it's been a good month. And
Ms. Johnson, so you are on board with the team promoting cancer awareness, particularly for cervical cancer, eh?
Yes, sir, I am.
Very good, very good.
And that video actually that was just shown, I saw it come onto my Facebook, but I also noticed that there was 1,300 views of this video when I had seen it, and more than 40 shares, and people were just thanking her so much for making that video.
Very good.
Yeah, so that's why I wanted them to come on the show today.
Very good. You did a good job by bringing them on the show, Bianca.
Thank you.
Thank you so very much.
Yeah, we learned a lot.
Yes.
Thank you for having
We learned a whole lot, and I am sure a whole lot of people are more aware now of this problem, and hopefully we'd see a whole lot of people get screening, and men and women. Yes?
And get the
Wow.
vaccine.
Getting the vaccine.
Vaccine for the men.
Vaccine for the men, not screening for the men,
Yeah, we don't
but
have a screening
vaccine.
test yet.
So fellas, get the vaccine. Okay, thank you so very much.
You're welcome.
Appreciate it very much. Thank you, Ms. Johnson.
You're welcome.
Thank you, Bianca.
Thanks.
Thank you for watching and listening to our program. Good evening, everyone.